work on the lower back, we can actually use some of the kinesiology tape to help reinforce the manual work that we did, and particularly if the athlete or the golfer is going to be playing some rounds, or they want that extra reinforcement when they go home, when they leave, to help kind of support those lower back muscles. It can actually help as well support the correct posture that we want them in terms of that neutral posture, as opposed to particularly the common one we see with the low back pain is that anterior pelvic tilt or that S posture. So what we're going to do, she's in kind of a golf posture, but supported with her upper body. We're going to use the kinesiology tape. First, going to just kind of give an eyeball measurement of how much tape that I'm actually going to need, knowing that it's going to stretch some, so I don't probably need the full amount I don't need, since I'm going to stretch it, I can use a shorter amount than in this non-stretch position. And I'm going to cut 2 strips, one for each side of the back, because we're just going to support either side of the spine there. With some techniques, we actually cross over the spine. With this particular one, we're not going to actually cross over the spine, just so that she doesn't have any restriction in terms of her rotational ability. From there, I'm going to actually round off the corners so that when her clothes brush against it, it's less likely to kind of peel off. So we're going to round off the corners of the tape, the 2 different strips. And now we have 2 different strips that we can put here. We want to make sure that the surface is nice and clean, that there's no lotions or gels or anything. So once we did our soft tissue work, we want to make sure that if we use any emollients, that's nice and wiped off and washed off with soap. Otherwise, the tape is not going to adhere quite as well. So the other thing is, when you're putting the tape on, you want to make sure that you're not actually touching the adhesive part too much, because then it starts to lose its adhesiveness. So we're going to actually make a little tear kind of on either side to provide some ends that we can actually use to help handle the tape, where we can still touch the backing of it and we're not touching the actual adhesive part. So from here, kind of depending, it's really up to you whether you want to start at kind of the mid-back and pull down to the lower back, or if you want to do the opposite, start down the lower back and pull up to the mid-back. There's some thought that starting one way versus the other helps with activation and or inhibition. There's not a lot of research for that. Actually, there's not any. So kind of whatever makes most sense for you. With Chloe here, we're actually, because she tends to have a little bit of that S posture, we're actually going to put her in a little bit of an anterior tilt so that it's in that shortened position when we actually put the tape there. So we're going to tear off the one piece of tape, and we're going to start high with it and just secure it on the one side of her lower back. Then we can peel. And the nice thing about this tape is, with these indicators, it kind of tells us, it gives us an indication of how much stretch we're actually putting on it. So if we stretch where the smaller hexagon becomes an equilateral hexagon, that's 25%. With the larger one, if it becomes an equilateral hexagon, that's going to be a 50% stretch. So with her, because we're going to try to get some muscle support, we're actually going to go for the 50% stretch. So a little bit more stretch with that. So I'm going to pull to the point that it's a nice equilateral hexagon, and then place the tape. And I'm going to keep working it. Nice equilateral hexagon, place the tape. I can pull that piece off. I'll still pull, and I'm just securing it down as I go. And then I can pull that last little piece off, and again, finishing the tension so it's down the lower back. I'm just going to rub along the tape. That kind of helps the tape adhere as we introduce some heat to it, and we're good to go on the left side of the back. We're going to repeat the process on the right side. So we make our little tabs to hold on to, make our tabs on either side, and from there, again, we're going to secure up at the top. Secure that, And once I have that nice and secure, then I can start to introduce my stretch to it. Again, we're doing the 50% stretch, so we're trying to get that larger hexagon to be an equilateral hexagon, so all the sides are the same length. And we're pulling. And we pull, we secure as we pull, and then we're going down to the lower part of the back there. And so now, again, she's just reinforcing those muscles on either side. Those erector spinae on either side of the spine tend to be the ones that get pretty angry and get tight as they're overworked. And so the tape helps to just support the muscles like that. Again, she can golf with that. Someone can help her out at home to tape this when she's on the road. This is a great choice, particularly for a lot of my golfers who are traveling. They throw some tape in their bag, and if the back kind of acts up or feels like it's a little tired after multiple rounds, great way to reinforce that. You feel better as you play until we're able to get back in and continue to do some therapy.